And welcome. Today we're going to talk about COVID-19, and we're going to add a little bit of a twist to it that you may not have heard. I'm Dr. Perry W. Buffington here at the University of Georgia, and delighted to have you with us. Now, some of you may have attended my previous seminars about COVID-19. So what we're doing is we're taking that particular seminar, doing a little bit of an encore with it, and adding some new material which you might find helpful. Couple of disclaimers that I need to tell you before we go any further. It is possible that everything I say to you right now will be absolutely obsolete in the next 5 minutes, and nothing takes the place of your medical physician, authority, nurse practitioner, PA. Trust me, they're your best line of defense. This presentation is for information only, and my opinions are mine and do not represent the University of Georgia. So what's all this about COVID-19 and how did this speech start? Well, it started with a simple tweet because one of my students said, how should we act while all this is going on? And I said, well, it's as simple as A, B, C, D, and E, and we're going to spend a lot of time on that. A is act as if you have it, because if you have it, you'll protect yourself and others. Stand back at least 6 feet, and in just a moment, I'm going to explain to you that 6 feet just may not be enough. Clean your hands, cover your mouth, and wash your hands for at least 20 seconds. I have found that 2 choruses of Glory, Glory to Old Georgia is just about the right amount, and don't forget to wash your thumbs. Disinfect anything and everything you possibly can. I know that sounds like I'm telling you a joke, but disinfect anything and everything you possibly can, and never forget we're all in this together. One of the main questions that my students that they want to know is, well, how did it get its name COVID-19? And if you look at COVID-19 and break it up, you see that the CO stands for corona, VI stands for virus, DI stands for disease, and it was identified in 2019. The original name was from Wuhan City in China's Hubei province, and it was a novel coronavirus. Novel, in that case, the N means brand new. We've never seen it before. It does, however, have a very formal name, and the formal name is SARS-CoV-2, and SARS stands for Severe Acute Respiratory Syndrome. It's a fascinating little virus. It's called a corona because it has a crown, and it's covered with those crown of spikes, if you will. To take it a step further, what is a virus? Because I found it's one of those words that a lot of people use, but they don't have a clue what it is. A virus is a live chemical, and virus is actually Latin for poison. What's a virus? Well, right there on the screen, it's a piece of genetic material that enters the cell, hijacks the cell's machinery, and then reproduces the virus. For your information, virus versus bacteria, well, a virus is unlike bacteria because viruses cannot copy themselves without a host. One little bit of good news with that is that the SARS-CoV-2 does not mutate as quickly as other viruses, and that may be a potential source of treatment. Okay, what makes Corona-19 unique? And this is absolutely fascinating, and it has to do with 29 proteins. Now, a protein is a complete biological molecule in a stable conformational stage, but those 29 proteins also have accompanying them what's called accessory proteins, and the accessory proteins may be more of a problem. Now, these 29 proteins, not a lot. Bacteria tends to have more protein, but these 29 proteins, you are familiar with the fact that it's enough to attack human cells. It's enough to challenge the tens of thousands of proteins in the human body. It's enough to engulf enough cells to kill so far more than 100,000 people. And those little 29 proteins are enough to halt the world. Now, 29 may sound small, okay? And in fact, it is. Bacteria has hundreds, perhaps even thousands of proteins. And the problem is, unlike bacteria, if you have all these proteins, for each one you've got, that's a place to attack and solve the problem. But COVID only has 19, so 19 potential sources that the biologists can work with to solve this problem to make it go away. The accessory proteins, they may be the bigger problem because no one knows exactly what these accessory proteins do. In fact, it's thought that these accessory proteins might serve as a cloaking device and may keep the virus from responding to these accessory proteins in a rather unknown way. Now, what I find fascinating is, why is everybody saying 6 feet? why do you have to stay back 6 feet? And the answer is, well, it has to do with the sneeze. Let's talk about the humble sneeze. There is no scientific name for a sneeze, but that explosion of air that results from the sneeze does have a name, and that's called a sternutation. So actually, instead of saying, excuse me, I need to sneeze, you probably need to say, excuse me, I need to sternutate. It'll make you sound far more sophisticated. There is no, to my knowledge, there's never been a sneeze named in a person's honor. And a sneeze is going to eject just basic stuff that you don't need in your system from the nasopharynx region. A cough is going to expel unwanted material from lower in your throat and lungs. But a sneeze is a nose reboot, to borrow a technology term. And what happens is when your nasopharynx is overwhelmed, the sneeze is triggered, and it tends to reboot with a pressurized force that resets the nose environment. Now, there are some sneeze facts you might find fascinating. And one fascinating sneeze fact is as follows. It is a highly atomized nasal-oral discharge. Atomized droplets can be hurled at a speed of 30 meters per second. You sneeze at 103.6 miles per hour, and remember, a fastball is between 95 and 105, and there are causes of a humble sneeze. You can sneeze as a result of exposure to light, which is why a lot of people will sneeze when they walk out of a dark theater into the sunshine. You can sneeze because of mental images, specifically erotic thoughts. And I think for the sake of dignity and decorum, I'll just leave it at that and not take that one any further. And you can also sneeze because of psychosomatic cues. Not unusual to see somebody else sneeze, like a cough or clearing your throat, and you have to do the same. Additionally, in one simple breath, the field of pneumotometry tells us that in one simple breath, air currents can carry an aerosol virus particle as far away as 20 feet. Now, if you remember your geometry, that's enough to fill up an office, a meeting room, a department store, a food store with vortices in air that can take the virus to every nook and cranny. And if you don't remember what a nook and cranny is, a nook is a corner and a cranny is a crack or a crevice. A virus is actually so small, some people believe it can actually hitch a ride on a dust particle. So 6 feet may not be far enough. In fact, it may be the reason, or one of the main reasons, we need to start wearing masks, which we'll talk about in a second. Now, the old God bless you as a result of a sneeze came from Pope Gregory, because Pope Gregory believed that the sneeze was beginning to imply that you had the plague. So as a result, you need every blessing you can get. Gesundheit, I typically don't use that one. I typically say, God bless you. Gesundheit is German. Gesund means health. Halt means hood. So health hood is what it stands for. And it first used in 1914, about the time of World War I. Now, what else do we know about sneezing? Well, you can get a condition called intractable sneezing where you can't stop sneezing. It's rare, it's painful, it's funny if it's not you, it's incredulous, hard to believe, and there may be a psychological influence behind it. But there are some very famous cases of intractable sneezing. The most famous is held by I think it was an individual who was recovering from influenza, sneezed 25 times a minute for 3 consecutive years. I did the math on this, and that amounts to a sneeze every 2 heartbeats, a sneeze, 3 sneezes per breath, 150 sneezes per hour, 36,000 each day, 13,400,000 each year. And finally, although no one knows how or why, the patient was cured on the 39,420,000th breath. Other sneeze records, 3 per minute for 33 days, and then there was one poor unfortunate soul that sneezed 700 sneezes for 30 minutes. What are the symptoms of COVID-19? Here we go. Fever. 88% of the population will get a fever, 12% will not. Dry cough. 68% of the population will get a dry cough. Fatigue, 40%. And these figures are reported by the World Health Organization. Other particular symptoms which seem like we're adding a new one every week: shortness of breath, stomach issues, weakness, headache, sore throat, loss of appetite, loss of sense of smell, and 2 new ones that have just been added this week: nasal congestion, which seems to go hand in hand with shortness of breath, and sudden confusion, particularly when you wake up. You seem to be just a little bit confused upon waking. Take it a step further. Something new that came out 2 weeks ago is this inflammatory eye condition, which looks like pink eye. This was reported in the Journal of American Medical Association Ophthalmology, and it looks like red eye, or pink eye rather, and approximately 38% of the population will show some kind of conjunctivitis. There are silent spreaders among us. And these silent spreaders, about 6.4% of the population, they transmit the disease and they are totally pre-symptomatic. And about 20% of the population, it is worthy of note, never develop symptoms, they just spread it. Here we go. What do you have to worry about with COVID-19? And the answer is birthdays. The older you get, the more you become a risk. Chronic lung disease makes perfect sense. Shortness of breath is a main side effect. Diabetes, high blood pressure, weakened immune system, and underlying health conditions all add up to the probability that you'll have a more difficult time or more likely to catch COVID-19. It's easy to catch. In fact, it is believed that it's 3 times easier to catch than influenza, and also it was thought that maybe one person could give it to 2 other people, but now it appears one person with COVID-19 can give it to as many as 5 or 6 other people, and you can do the spread of that just by thinking about 5 to 6 turns into 12, turns into 24, turns into 48, and it goes through the population like gangbusters. What else do we know? There are some treatments, none of them spectacular at this point in time. Let's look at some. First off, there are currently more than 100 existing experimental drugs that are being tested for COVID-19. Drugs, vaccine, other attempts, and they're designed to block the viral proteins before they can replicate, block them before they can hijack, suppress, and evade the human cellular machinery. There are, sorry to tell you, fake treatments out there. My favorite one has to do with this hair dryer. This is a fake treatment. Let me put that in red so that you can see I'm saying do not try this at home. This is where the thought is that the heat is going to kill the virus in your nose. So you take the handy dandy hair dryer, put it on high, put airflow on high as well, heat on high, and just blow air up your nose. This does not work. This is only one of many fake treatments out there. Just pay attention to the CDC, World Health Organization, and your primary care provider. They are the best source of treatments for this. Now, legitimate researchers are doing some interesting things. They are mapping the structure of COVID-19 atom by atom. They're screening molecular libraries in blood of COVID survivors to see if they can find a cure for you. They are focusing, this one I find fascinating, on the way viral proteins interact with human cells, which means these treatments will try to kill the human cells that are inside of you. Now, we've heard a lot about drugs. Hydroxychloroquine, it's out there. Politicians, a lot of people are talking about it. They're saying, give it a try. Unfortunately, at this point in time, the research on it is strongly suggesting that it is of minimal help at best. However, a lot of research is being done to see if, in fact, it can be of a more successful than it currently is. Remdesivir is something you're going to hear a lot about, and that's GS 5734. That's just the drug manufacturer's nomenclature for that drug. It is actually going to target the viral proteins, which copies RNA, so that the genome copying step can not happen. And as a result, it inhibits the virus from replicating. The UK, China, and the US is pioneering this particular treatment. You'll hear a lot about proteases, and they're designed to free individual viral proteins that are linked together in one long strand so that you can stop the virus from even living. And you're going to hear more about other treatments like antibodies and serology testing, which is the ones that I think hold great promise to tell us who has it, who hasn't had it, and whether we've developed an immunity to it A lot of research being done on nitric oxide to see that if it's inhaled, it appears to kill the coronavirus. And then a drug that I'm looking at, because this is my area of expertise, how do these drugs work, is Kineret. And Kineret is an immunosuppressant right now for rheumatoid arthritis that tamps down the immune system. So the question is, why would you need a drug that tamps down the immune system? And that's going to get into something called a cytokine storm, which we'll talk about in a second. I don't expect, from what I'm reading and studying, but remember, what I say could change tomorrow because the research is certainly in flux and growing and developing. I expect a vaccine by next spring. And this is one of those vaccines that I think can hold great promise from what I've read and from what I'm hearing and seeing in the research. There is a new drug that's being tested at the University of North Carolina, Vanderbilt, and Emory. It doesn't have a name yet, it just has a number. And the number on the screen there is EIDD2801. And what this one does is this one blocks the replication of the virus. And it's really important because this drug, this virus really loves to attack your lungs. And so this drug is thought to reduce lung damage by blocking what's called a cytokine storm. Now, a cytokine storm is when your own inflammation system just goes wackadoodle. Not a real clinical term, but it means it's a runaway immune response where you have too many immune cells that flood the infection site. And when that happens in your lungs, well, fluids build up, shuts down breathing. So these drugs are thought to help reduce the inflammation, to reduce the probability of a cytokine storm. So what to do? I mean, this really is the million-dollar question. And the answer is, first off, the state of Georgia has a new COVID-19 hotline. I'm going to read it to you. If you believe that you are experiencing symptoms of COVID-19 or have been exposed to the novel coronavirus, please contact your primary care doctor or an urgent care facility. Please do not show up at the emergency room unannounced. And there is a hotline available to you here on the screen, which is 844-442-2681. That's 844-442-2681 for advice and guidance. In the meantime, follow your ABCs, and I'm going to add a couple to it. A, act as if you already have it. Maybe you want to seriously consider standing back more than 6 feet. Clean your hands, good advice, as often as you think of it. A lot of facilities are saying 15 minutes, every 15 minutes, especially in for healthcare providers. Cover your mouth and nose. Disinfect anything and everything you possibly can. Everybody's in this together. And I'm going to add an F on this, going to add a G in a moment, but right now an F, which is there's a lot of loneliness associated with this. There's a lot of quarantine associated with this. There's a lot of social isolation. And the elderly is particularly is feeling the pain of being alone. This is one of those times you need to reach out often to your friends and family, especially those who are elderly. So you got some anxiety. I mean, has your 401k turned into a 200.5? The bottom line is lots of people have anxiety. They have questions. They don't know what to do. They're afraid. So as a result, words are beginning to pop up in the lexicon to try to explain what we're going through and dealing with. My personal favorite is quarantini, which is a martini and a palliative care for the homebound. After 5 o'clock, rest and relax a little bit if you can, if you don't have an alcohol problem, with a quarantini. And take a look at this one. This one's pretty cool too. For all of those of you who are celebrating your connubial bliss with nothing else to do during this time of separation, if you have someone whom you love and you're in the process of perhaps thinking about another child, well, these children will be called coronials. These are children who are born in the time of the coronavirus. And then we have doom scrolling. That's for those of you who are constantly looking for information and just scrolling up and down on your telephone, trying to find all the good news and bad news on your iPhones about what's going on. That's called doom scrolling. And take a look at this one. For those of you, or for those, certainly not you, because you're listening to this video, for those of you who think that this is just not real, we have a name for those people as well. They are referred to now as COVIDians. What to do? scary time. I mean, this is a novel virus. We haven't seen this before. Is it time for you to wear masks and gloves? Are you afraid of a pestilence like in the Black Plague? Well, I have made the decision that it is time to wear a mask. The only problem with that is a lot of people don't realize that wearing a mask may give you a false sense of security where you think you are protected. And in fact, that's not it at all. If you wear a mask and gloves, it's even more important to be more vigilant because the mask is protecting, but when we think we have a Dumbo's feather, if you will, like from the Walt Disney movie, it may not be protecting you as much as you would like to be, and we tend to lose that sense of vigilance. Don't lose it. In fact, when you put on the mask, become more vigilant. All right. I suggest a calmer approach to this problem. C, work on your cognitive skills while you have a little time to yourself. It's a great time to learn Japanese. Goshi nashimasu. It's a great time to learn to play the piano. It's a great time to learn something new. It's a great time to learn something that you've been wanting to do all over your life. YouTube is a great source of knowledge. Do something that keeps your cognitive skills strong. Focus on the positive. Accentuate the positive. This is a negative time. If you turn on the TV, if you watch any of the cable channels, you're going to hear the same thing repeated just in one continuous loop. My rule is I'm going to watch it about an hour a day, and that's it. In the meantime, I'm going to try to do something that has a little bit more of a positive flair. L is love a lot. Love doesn't necessarily, you can't hug someone right now because, we don't have a lot of people close to us, but that doesn't mean you can't think about them and develop an empathy for their problem, because there's a beautiful relationship between empathy and the ability to stay strong and to stay healthy. There's a beautiful relationship between the empathy, thinking about and worrying about, if you will, and figuring out how you can take care of other people and developing cognitive skills. M is incredibly important. It stands for move. Your brain has one job. Thinking is important, but your brain has one job, and that is to keep you moving. How many people do you know who have retired to their big easy chair, stopped moving, and they started turning into gelatinous goo from watching too much TV? You need to move. You need to get up. You need to exercise. This is an excellent time to improve your cognitive skills. This is an excellent time to improve your overall health by exercise and moving. Please eat properly. Eat foods that reduce the probability of inflammation. I hate to tell you this, but that means fruits and vegetables reduce inflammation or improve your immunity. Fried foods increase inflammation. And you also want to get the proper amount of rest, because this is a time when rest and staying healthy is going to be incredibly important. Here we go. I'm almost finished. What is the key takeaway from today's 30-minute diatribe? We're all in this together. If you protect yourself, you protect everyone else. So on that note, one final point, let's add a G, as in our A, B, C, D, E, F, and G. And it seems like this may be the time when Pope Gregory had the correct idea. So in addition to acting as if you have it, stand back more than 6 feet, wash your hands regularly, disinfect, everybody's in this together, phone a friend, allow me to say for your health, God bless you. Because this seems to be the absolute appropriate time to use what Pope Gregory had in mind. One final point before we're out of here stage left. We do some great work here at the University of Georgia Griffin campus. We are a land-grant institution, the oldest in the nation, and we work for you. So on that same point, if you need us, we are here for you. We are here to help you any way we possibly can. And if you know someone who would like to complete their undergraduate degree, or maybe even take on a bachelor's or a master's or a doctorate degree, all you have to do is give us a call at 770-412-4400. That's 770-412-4400. At the risk of sounding like an infomercial, operators standing by. And who knows, you may just luck out and get an outstanding professor, because we have some of those here, a goodly number of them, not mention the researchers, that can just open up your worlds in ways you never believed possible. You are always welcome here on the University of Georgia Griffin campus. So on that note, that's it for me. I'm Dr. Perry Buffington. I was pleased to share with you what I know or what I think I understand at this point, and I will finish with the final point. Protect yourself. You protect all of us. Be vigilant, and we are all in this together. It was my pleasure. I look forward to the next time.